it's Patricia here. Thanks very much for joining me for this interview with Andrew Scarborough. The first time I met or came across Andrew was on a Twitter chat actually, and we were talking about individualized protocols of the ketogenic diet. And I was very intrigued, to say the least, by his very unique and unconventional approach to the ketogenic diet, but even more impressed by the results he's getting. And as always, if a cancer patient gets extraordinary results with treatments that aren't quite conventional, there is usually a lot of media attention, and that's what happened to Andrew as well. So both Andrew and I, we were very keen to clarify a few things, especially with regards to his diagnosis and with regards to the use of the ketogenic diet as well, and whether this is a suitable approach for absolutely everybody. And because it is a controversial topic and the media like to jump onto controversial topics and to make it their own, we hope we clarify a lot of things in this interview, and I'm sure you're also going to learn loads and how to incorporate certain really nutrient dense foods into your own unique protocol and approach. So how are you doing? Did you have I saw you had another interview yesterday.
Yeah, that was kind of interesting.
Tell me
They
about
kept
it.
saying the word cure, so
Oh no, yeah.
it's it's an interesting kind of area with just terminology and media, radio stuff, articles as well.
Mm.
Just it's they need to have a story, so
I know,
it's
that's it exactly. It's sort of sensationalism a little bit as well, I think.
yeah, it's a good thing and a bad thing because it raises awareness, and it raises awareness of what I'm doing as well,
Mm.
which has huge potential, but you can't really say anything definitive. So
Yeah,
um, it's an interesting area of discussion,
yeah,
definitely.
definitely. Yeah, but I think it's always it's good to clarify. I mean, when people say, "Oh well, are you completely cured now?"
Yeah,
Yeah, I guess I am because my tumor is dead, but it
yeah, that's
it's
true.
always
I'd say the aim for me is definitely, even though it's like an ambitious aim, if you know a lot about brain cancer, the aim is cure, but we know that there's no known cure, so we need to have more clinical trials for people doing, what we're doing. I know
um,
because I was misdiagnosed many times
yeah.
after my brain hemorrhage, and I only got my uh, proper diagnosis 6 weeks after my operation. So
No way.
that's
Oh
yeah,
wow.
I
So it
received a phone call on a Friday evening, 6 weeks after the operation, and was told that it wasn't what they thought it was. It was this very malignant brain tumor.
wow. Yeah. So you
Yeah,
it started with a hemorrhage, basically.
yeah. I suffered a brain hemorrhage after a gym session uh, in April 2013,
All right.
and that could have been fatal in itself.
Yeah.
And then I was rushed to hospital. I had many tonic-clonic seizures, and they told me that it could have been either an AVM, which is an arteriovenous malformation, which is quite a serious, life-threatening thing.
Yeah.
And then they said, "Oh, actually, maybe it looks more like a cavernous hemangioma, which is a mass of abnormal blood vessels in the brain that you could actually, if it's asymptomatic, you could leave it in there for for the rest of your life. But if you continue having seizures, usually they um, would attempt to remove it, and then you just go on with your life, and it's all rosy and happy. But yeah, there was so much blood on the scan that in the brain that they couldn't really tell what was going on. But but then I kept having tonic-clonic seizures very frequently. And even then, on the NHS, I could only have, if I wanted an operation, I could only have it 8 months from from that point.
No way. Wow, is it
Yeah,
just such a long waiting list or
it's just that they treated it as a very benign thing because it was misdiagnosed.
right, okay, yeah.
So I ended up actually going private and then having the operation because it was causing me just these, these horrific. I was having these horrific symptoms where I just had facial paresthesia.
Mm.
I had so many injuries from the seizures I was having, and I would go unconscious for long periods of time.
Wow. Wow.
So yeah, it was a good idea to have the operation when I
Yeah,
did.
definitely. Yeah.
Uh,
Yeah. I mean, it's
and
always, I think the private public system,
yeah,
I went private as well afterwards. Yeah.
yeah, it's a shame, really.
Mm.
But then my neurosurgeon said, yeah, if we knew what it was initially, yeah, even on the NHS, I would have had that that surgery as an emergency
Yeah.
because it was yeah, malignant, and there was some disease that they couldn't remove attached to the motor strip in my brain. So
Right. Okay. Yeah.
yeah,
So, and then
uh,
6 weeks later, you got the phone call after the operation. So you thought everything was fine and the symptoms were gone, or was there still quite a lot of symptoms after the operation, I guess, as well?
yeah, I was still having seizures after the operation for quite a while. And I was on they put me on a huge amount of different epilepsy medications,
Mm.
which had their own very debilitating symptoms. I was also on codeine, morphine, Oromorph,
Wow. Yeah.
and just paracetamol as well. So I was on just loads of drugs.
Mm.
So I actually became quite dependent on those painkillers too, which had their own problems. So
Yeah. Yeah.
coming off all that was a huge struggle, but I wanted to do that because I hated being on drugs anyway.
Mm.
So yeah, I was told over the phone about just how I had this thing that was. They still didn't know how to define it, but they told me it was I would have to have chemotherapy and radiotherapy, and that my tumor was. They told me it was a tumor and not a cavernous hemangioma, which was a huge shock to me
Mm.
because even on the discharge notes after my operation, it said cavernous hemangioma. So
Mm. Mm.
I was just really shocked that they told me over the phone it was something that was actually a malignant brain tumor and was um, it was incurable but treatable.
Mhm.
And I didn't quite know what that meant. They kept saying
Yeah.
palliative, so palliative
Oh.
care. So yeah, I didn't know much about. I was quite ignorant, really. I didn't know much. Well, quite naive. I didn't know much about uh, brain cancer apart from the little bits I learned when I was doing my master's in nutritional therapy.
Yeah. Yeah.
So I only touched on it briefly, but also because I had no disease in my family before
Mm.
that, I just thought, oh, something like that wouldn't happen to me, especially
Yeah.
studying nutrition and being so, having worked as a personal trainer as well. It
Mm.
was
Yeah.
a huge shock, but I, yeah, I did a lot of research into long-term survivors just almost straight after I got over the shock, which
Okay. Yeah. Great.
it took just about an hour of thinking, oh my God, I'm going to die. What's happening here?
Mm.
To just trying to take action and do something about it.
Mm.
So yeah, I contacted just a load of long-term survivors who I tracked down from various news stories and uh, I looked into just because I'd studied, well, must have been around 6 years of nutrition in total.
Yeah, yeah,
I had the analytical skills, luckily, to see what's good and bad on the internet.
yeah, exactly. That's quite an art,
um,
isn't it?
yeah, exactly.
Yeah.
You need to kind of learn a lot about neurology, and also just oncology yourself to to actually take control and understand these uh, very complex, um, I don't know how you
The
describe it, but
terminology as well, I think
processes
that can
in,
be, yeah,
yeah,
and all
all
the,
the
yeah,
jargon that they use.
I
Um,
know, yeah.
but yeah, once you understand it, it's quite interesting. So I
Mm,
actually, because I didn't understand, I was still learning. I went ahead and had uh, radiotherapy and chemotherapy for a while,
mm-hmm.
but I was constantly having dialogue with my oncologist, just asking about the pathology of the tumor, and he said that it was unlikely to respond to chemotherapy at all, because it didn't have any of these mutations which are deemed to be preferable to have.
Mm, yeah,
And my tumor was highly vascular, so we didn't know how it would respond. It's not usually a good thing to have a constant blood supply giving
yeah,
nutrients
yeah,
to the
exactly.
tumor to help it to grow. So
Mm,
I decided after a while to stop having the chemotherapy, which
mhm.
was kind of against the advice that I was given. And then I decided to transition onto a ketogenic diet, which I found very difficult at the time,
Mm,
just because, well, very fortunately, I wasn't on um, steroids
okay,
for
yeah,
brain swelling, which was a
yeah.
big
That can
positive.
that can put a big spanner in the works. Yeah, definitely.
Yeah,
Yeah.
and I know so many people who have been on the steroids, and they're not really aware of how the treatment affects them, because they're it's they're just, it kind of takes away the tiredness that you experience if you're not on the steroids. So
Yeah,
I
yeah.
was extremely fatigued, so I could understand just what was happening in my brain from this toxic treatment. So just that, and the fact that I was told that uh, the pathology of my tumor suggested that treatment wouldn't have any real benefit to me, and it may actually make things worse, may cause
Mm,
more
yeah.
gene mutations. I decided to cut my treatment short, especially since the suggestion was for me to have chemotherapy for up to 2 years, which
Wow,
is
it's a
a
long time.
really
Yeah,
long time.
yeah,
So yeah, I chose to quickly abandon that, and at first I read the book Cancer as a Metabolic Disease
yeah.
by
With Tom
Thomas
Seyfried.
Seyfried.
Yeah,
Yeah, so you know about that, I know.
yeah.
And I just learned about cancer metabolism, how you can potentially exploit weaknesses there. And I know that sometimes people will oversimplify things by saying uh, cancer feeds on sugar, so just take out sugar.
Mm, yeah.
We know it's not as simple as that. You need to glutamine is also a factor there, where you need to restrict protein as well to have a better effect. And also there's therapeutic fasting, which I did for a while, but then had problems while being on all this epilepsy medication with the
Mm,
fasting.
yeah, yeah. I'd say so.
So yeah, I did that just as an intermittent fasting, but then I was still having problems. I was having breakthrough seizures just from drug withdrawal and from just, I guess, as a reaction to lowering carbs and becoming keto adapted.
Yeah. Yeah.
But then every time that I'd reduce the medication, I'd have a withdrawal effect where my symptoms would get worse before they got better.
Yeah.
And even though it was a terrifying thing, I just persisted with it because I thought, well, there's no other real. I was just very determined to do something. So I knew that if I didn't do anything, that if you follow the standard treatment, you'll get the standard responses, which is you'll feel like a zombie being on all this medication for epilepsy where you can't even go out because you're so fatigued.
Yeah. And that's often the question, I guess, with treatments as well. I mean, it's one thing curing cancer or managing it, but the question is, what's quality of life like? I think for me, that's personally, that's almost as important as, if treatment works, and it's just the quality at the moment as well. And if you get cured, but your quality of life is really, you're so tired or you have a lot of side effects. I mean, I know it from myself. After treatments, the eye was so badly affected. I didn't have any balance, so I couldn't do exercise as I wanted to.
Yeah.
And I poured, when I wanted to cook, I poured everything beside the pan. And I was just saying, wow, that's it took me a long time to adapt to that, and it wasn't the quality of life that I'm used to. So I guess if you're a bit ambitious and you really want to have a good life, you want to exercise and you want to feel well and
I was
healthy.
extremely active before, and I couldn't even I struggled to just walk from one side of the room to the other. I was bedbound for months. So and I was having speech arrest as well, where I could either think of the words but not get them out, or I could get words out but then I'd forget the words and I couldn't think about what to say. So so I continued with restricting my carbs on this ketogenic diet.
When did you start, actually? Sorry, when did you start the ketogenic diet, and how long did you have chemo and radio beforehand?
Okay. Well, I had the standard 6.5 weeks for high-grade glioma of chemotherapy and radiotherapy together. But then I was supposed to have cycles after that for up to 2 years. And I decided to stop after 3 months of that.
And do you know if actually, in terms of scans, do you know if it had any effect, the chemo or radiotherapy, or was that
well, the interesting thing about that is that there was actually signs of enhancement coming up.
Oh goodness!
After my chemotherapy and radiotherapy, and before I continued on to the cycles that I had, so that seemed to actually be getting a bit worse. So
so that makes a decision to really drop combat. Definitely.
But again, we know that these scans, you can't really tell much, especially because at the time I was having less detailed scans than I have now. So one of the big things that I'm working to do with my local MP is to try and get better scanning equipment in all hospitals. So I'm at Charing Cross Hospital at the moment, where they have MRI spectroscopy, which is a much more detailed type of MRI scan to what I had at the Royal Marsden, which is kind of grainy and you can't really see much detail. MRI spectroscopy also looks at the environment, the microenvironment as well, just to look for biomarkers of you could possibly detect cancer progression just by looking at certain things like elevated levels of choline and in the brain, and it's just really around the tumor site. It's just really interesting looking at that research.
So do they have that type of MRI then in a lot of hospitals, or is that mainly now?
No, it's only very few in this country, so it's quite worrying in a way, just the huge variation in care from one hospital to another.
I know. Tell me about it. Yeah.
So one of the things I'm aiming for is my oncologist recently offered me work as a patient advisor, and also at Charing Cross Hospital.
That's fantastic.
And also he wants me to work in the lab alongside individuals at Imperial College London. So
wow,
that's quite exciting to be able to.
Congratulations.
Thanks.
Brilliant. Yeah.
So that'll probably be in September. I'll be starting that because it's part study. So I didn't get to complete my master's. So I get to do some work in the lab, which is quite exciting.
Great. And then you can finish your master there and sort of go completely ketogenic.
Yeah, definitely. So I worked with initially when I started my ketogenic transitioning into a ketogenic diet, after I'd chosen to stop my chemotherapy around 1.5 years ago now, I contacted Matthew's friends, which I'd heard from through actually email contact with Thomas Seyfried almost 2 years ago now, after my diagnosis, and he just gave me loads of resources onto just got me in contact with Dominic D'Agostino and Adrienne Check, who are at the forefront of this kind of research. And then I got the book Keto Clarity, which is kind of a very basic way of helping you to understand all this stuff, which I would suggest any brain cancer patients or anyone with any kind of neurological disease or disorder, if they're starting on a ketogenic diet, it's a really good resource to help them to understand the basics of it.
It's Jimmy Moore and then Dr. Westman as well.
It's just very easy to understand in layman terms. So,
and I guess also Perlmutter's work, Grain Brain and Brain Maker, those are very helpful too, I guess. But definitely. It's more about obviously the brain, just focused on the brain and not necessarily keto.
Which I think personally that it should go beyond ketosis anyway. There's a lot more going on, which that can kind of be ignored. People are sometimes focused too much on numbers and just being in ketosis, which initially that's the mistake I made. So when I went on a traditional ketogenic diet, I actually failed miserably. And I didn't realize at the time that I just had lots of food intolerances. So eventually I learned that I was very sensitive to salicylates in my diet. So
which restrict you a lot, in terms of vegetables and nuts.
Exactly. So it's quite interesting as well, because if I explain my diet for my individual situation, people will see that and think because I eat kind of unorthodox things to account
Tell
for
us about it.
to account for the micronutrient deficiencies that I would have if I was to cut out all those cruciferous vegetables that I was eating, which are a great thing if you can manage them and get into therapeutic ketosis for cancer management without any problems. Then that's a good thing to do. But when I explain my diet to cancer patients and to the media in particular, people immediately think, oh, well, I have cancer, so I have to do everything that Andrew does, you know.
Yeah. And
which,
I think that's exactly the danger as well, that people just follow something and that they hear about, oh, such and such did this and this, so I'm going to just try it as well. And then they mix and match and it gets completely overwhelming. And obviously they don't get any results either.
Yeah, there's evidence to suggest that some of the things I do may have a lot of benefit for people as a whole, but it's unknown. So I'm experimenting in trying to have an optimal ketogenic diet for myself. So yeah, over the last couple of years, I've adapted my ketogenic diet while very gradually lowering my epilepsy medication, which I was advised against. I was actually advised to increase my medication. And I didn't realize at the time that a lot of the lethargy that you get from certain epileptic drugs, especially Keppra and Epilin, which was what I was on. A lot of the lethargy that you get from that is actually caused by the micronutrient deficiencies that you have as a result of taking these drugs.
That's right. Yeah.
Which are not explained by neurologists who I saw 5 different neurologists and they didn't know much all about nutrition, which was quite disappointing, really. But I now see one who is in the team at Charing Cross. They have a fantastic team, and they immediately understood what I was talking about when I said about the magnesium and calcium deficiency that you get as a result of being on high doses of these medications. So I started to adapt my ketogenic diet by having more bone broth, which, you know, it's very good for giving you the potassium and magnesium and
for healing the gut as well. I
and
mean, you probably developed quite a lot of food intolerances through the chemo as well. I see that a lot.
Yeah, and just having an acquired brain injury as well just makes you more sensitive to certain foods. So another thing I do is try to keep my omega-3 to 6 ratio as close to 1 to 1 as possible.
And do you test for that regularly as well, or?
I don't, but I just kind of I have an idea of where I am with that.
I actually do the test with quite a lot of my clients, and I just got some results back, and there's a lot of work to do. So it's actually the Holman test is really handy. omega3test.com. I don't think it's very expensive either. So
usually you send it off to a lab and it comes back. I'm interested in having one done just out of curiosity, but my diet's based largely around oily fish and lamb's brains and lots of
And
offal,
where do you source the organ meats? Is there a butcher locally that has is it all organic, or?
I have a local butcher and a local farmer who I'm in contact with constantly, so I know how the animals are raised. So grass fed is really important. So all the animals that have a grass fed, I eat the animal from, you know, head to tail. So
great.
I eat just about everything. So the reason I eat things like lamb's brains is because I believe that it has all the components that my brain needs to thrive. You know, it has the DHA. Your brain is made around 20% of the fats in your brain are DHA. So
that's an amazing source. Yeah, exactly.
It's a good thing to have. And I looked into research into Alzheimer's as well, and it was really interesting how there's a component that's found in cows' brains that they have used in pill form in some studies into Alzheimer's, and it's helped to slow down the cognitive deficits, and in some cases reverse some of the issues that are causing cognitive impairment with the plaque formation that you get around the hippocampus in Alzheimer's. So I found that really interesting. So I thought, oh, I'd try and apply that to my situation. You know, it's all the brain. So
yeah, and I think is it in traditional Chinese medicine they say you should actually eat the organs that are sick in your body. So
yeah, there's a few traditional native cultures where that's the standard thing to do. You know,
to regenerate this organ, and you have all the nutrients. Makes sense.
So I eat liver, I eat kidneys, I eat sweetbreads, which is the thymus gland and the pancreas.
Yeah, because that's the other thing, isn't it, with the thyroid function that we're ketone.
And also if you're there's lots of these organ meats are actually more nutrient dense than the low carb fruits and vegetables that I would be missing out on from my micronutrients. So I do that, and I also eat insects. So insects are very nutrient dense again, and there's they have quite a nice taste to them as well. So
I ate them when I was in Asia, actually, more accidentally than anything. But I actually like them. Yeah, I have to see. You use cricket flour mainly, don't you?
Yeah, because I'm on what I would call a carnivorous ketogenic diet. I feel that there are certain benefits to that. So I don't have to count my carbs, which is a really nice thing. So I just count my protein and fat intake, and I can't have coconut oil because it's high in salicylates.
And avocados as well.
I can't have avocados as well. So most ketogenic diets are based around those foods. So how I get around that is I have lots of ghee, which is clarified butter. And that has a good amount of MCTs in it, the mixed chain triglycerides, which are what we're aiming to get lots of on these ketogenic diets for cancer management in particular, because your brain can use it very quickly for energy, kind of like it would use carbohydrates. And another thing that I've done recently is I've come off my epilepsy medication completely.
Wow. Great.
Which I was told would be impossible by 5 different neurologists. So I came back to one of them and just said what I've done, and they said, "Oh, that's really interesting."
Yeah, and my consultant always says, it's very interesting. Just keep doing what you're doing.
Yeah, I get that as well.
They don't go much further, actually. Yeah.